The Community Foundation funds nonprofits here in our community in Hendricks County. You know, it's a risk when you get a new nonprofit. We have the flexibility to be able to take a risk, and it was a risk well worth, but you have to take a risk to get big payoffs. Hope Healthcare Services has paid off hundreds fold.
I love the place because it gives people in the community that are uninsured, especially my patients from the emergency department, a place where they can go and get compassionate and excellent care.
The gratifying thing about volunteering at the care center is people are so appreciative. They're people that don't have insurance. They're people that are not on Medicaid. They work, but they can't afford to go to a private practice. And so they're very appreciative. And the great thing is there's always somebody praying for every patient.
1 in 7 children go hungry in the community. You can imagine what that looks like when it comes to the expense of health care. It always comes as a shock to people in Hendricks County in general that there is poverty. It's a very wealthy community, and we are, but that doesn't mean that people aren't struggling, and we need services like Hope Healthcare Services.
Before, when I was in Virginia, they weren't figuring out what was going on, and then came here to Indiana to Hope, and they've been helping me find out what's going on. Becky was the first lady I met at Hope. When I walked in, she greeted me very sweetly. She's funny, she's understanding. I feel comfortable around her, and I don't feel comfortable around a whole lot of people.
I love the stories that I've seen at Hope. It was a couple that came in that were middle-aged to elderly, and the husband had been having some worrisome symptoms often, and the wife had kept telling him that he needed to seek care. However, he was very stubborn, and because they were uninsured, he was afraid to go and create giant bills. And when I heard his symptoms, I told him, you know, the next time that you have this, you really need to go to the emergency department because I'm afraid you're having a heart attack. And he said, okay, I will. And I saw him several months later in follow-up. And indeed, he had had a heart attack while he was out walking, and luckily he remembered my advice and went to the emergency department, ended up with bypass, and the family was incredibly thankful and felt like I really saved their life.
There's really a need that Hope fills that need, and that people don't always see that. You know, they think, oh, affordable health care, it's out there, they can buy it. But, you know, a lot of people live from paycheck to paycheck, and a lot of people, you know, are really trying to balance what their spending are. They have a car that breaks down, unexpected things. And so, I mean, I think, you know, hope is there. Hope is there for them.
I've been volunteering at the care center from the beginning, really. I've met a lot of interesting people, a lot of wonderful people, and I've heard a lot of good stories. One in particular, a fella had some health issues, and he had several dental issues that were the scope of which treating them was, well, that and different reasons, we ended up thinking it was better to move him to my private practice. His sister had been praying for him and witnessing to him over many years, and he was resistant, as I understand it.
Over the years, I've tried to invite him to church and talk to him about my faith and the peace that I have found and the love that I have found. And I'm the baby sister, so nobody listens to me, and I couldn't convince him to come to church or to even listen. And my brother said, I have no money. He said, we're not worried about it. Let's not worry about that. And they cared for him. And as we left, about a half an hour to an hour later, we're walking out to my car, and my brother looked at me and he said, why would he do that? And my heart just leapt. And I said, let me tell you why. He's showing you the love of Jesus. He's showing you how God loves us. That's why he's doing it.
Because we opened our office and gave him treatment and took good care of him, he asked her, why would someone do that? And then she was able to share the gospel with him after that.
I talked to him last week, and he said, hey, I just got a phone call from Dr. Drigger's office. And I said, you did? He said, yeah. He said he wants to follow up. He wants me to come in. He said, why would he do that? I said, let me tell you why. Because he wants to care for you. He said, but I'm not sure that they understand. I said, they understand perfectly. They want to show you love. They want to show you God's love. You need to make the appointment for the follow-up.
This is what I do 90% of my, well, I'd say about 60% of my day. This is my therapy. Chet found out I was crocheting at one of my appointments before it was time to go in. I'm always early for things. And he saw me crochet and he said how nice it was. I found out that Chet and his wife just had a baby recently. So I made one for his baby. He connected me with a group called Baby and Me Tobacco Free. I've already took in 10 blankets for them and still working on more.
Hope really gives me a chance when I see those patients in my emergency department that don't have care because they don't have insurance and can't afford it. They can come and see me in clinic and follow up. I got to see them in follow-up and really knew that I affected this family incredibly, which was very touching to me and fulfilling as a physician.
My son Sam decided to go to dental school several years ago, volunteered, well, shadowed, I guess, at the care center before he got into dental school.
I figured it'd be a good way to kind of show up and observe some things behind the scenes and kind of learn a little bit about dentistry and a little bit about the ministry that they have there.
And then since he's been in dental school and he's actually finishing up this year, he's actually come with me and volunteered over there and began treating patients recently as well.
I'm excited to continue that at Hope and actually work on patients alongside my dad and kind of get into the ministry at Hope. A lot of different ranges of people. People that do need a lot of care, that have maybe been neglected or have kind of fallen through the cracks. And I think Hope is a great place for those types of people to come and feel loved and get the care that they need. The ministry aspect is great. I've seen so much in my limited time being there already, why it's being done, you know, why we care about these people and why we're trying to give them health care.
It means a lot to me, and it's very special to have my son follow in my footsteps and then to volunteer and to help other people as well.
Watching my dad work and seeing him, you know, put the time in and the care in to really help these people out and give them the care that they need. And I'm excited to continue that tradition.
Our job at the Community Foundation is try to build quality of life in our community. And one of the best ways is to have a healthy community.
Personally, for me, one of the things I look at a lot is where does my money go?
We've funded them every year for the past 11 years at some level, and to a sum of about $75,000. And they've paid out in free and discounted services millions of dollars. And you can't ask for a better return on your investment than that.
Your money, when you donate it to Hope Healthcare, the majority, vast majority of it goes to help the people that come into the clinic.
Having an organization like Hope Healthcare Services in our community providing these services, the impact is immeasurable. Our community would not be the same without it.
Every chance I get, I tell people about Hope, and about Chet and everybody there, you know.
I think it's just a great place, and I just really encourage you to pray about it and think about it and donate to Hope Healthcare.
As you've heard these stories of hope, we invite you to write your own story as a volunteer or a donor and join us in the bigger story of sharing the good news and the love of Jesus Christ through the provision of healthcare services to our neighbors in need. On behalf of our staff and our patients, I thank you.